Good afternoon, everyone. So I'm just gonna we'll get started. I know some people will probably be trickling in. I'm really excited to welcome all of you to our third annual Department of Medicine Women in Medicine and Science Seminar. And this is our first year doing it in person, so I'm really excited about that. So hopefully it'll be nice to have some time to network and meet and get to know people that maybe you haven't seen in a while, or maybe just new people that you haven't met on campus. Um, I really want to give a big thank you to Leslie Gewin for leading the planning subcommittee for this year, for organizing the speakers and sort of and the entire planning subcommittee as well. So Judy True, Shash Bagchi, Richa Bardwaj, Colleen McAvoy, and Nwet Nguyen. So we really couldn't have done it without their help and input in organizing our speakers. And then our superstar admin team, which none of this would have happened at all without Jen Mosier, and Takesha must be out manning the front table. But thank you both for all of your work with the organizing the space and the catering and writing up our itineraries and working with our invited keynote speaker, which we had sort of a scare yesterday with the floods and tornadoes in New Orleans. We weren't sure if we were going to have a keynote speaker, but it all worked out. So thank you. So we do have a terrific afternoon of some amazing accomplished speakers. But before we delve into our panel today, I wanted to take a moment to announce our AWAM Lead Award winners this year. We had a great committee that came together to review nomination packets from all of the highly accomplished and talented faculty. And I have to say, it was so much fun. I read through all of the nomination letters, and it was such a fun afternoon for me to read all of the letters from the nominees for all of our faculty. And I don't know, I love that kind of stuff. And if I could read all of the letters to all of you, I would, but we don't have the time. But the award is given to faculty who have demonstrated impactful leadership as either sponsors, mentors, collaborators, and who have really significantly contributed to the career advancement of women. And the nominations were split into two categories. So we have our associate professor and professor category and instructor and assistant professor category. So this year, our lead award winners are, I'm going to just say your names. You can start walking down, but I'm going to read just a little snippet from one of the letters. For the assistant and instructor category is Dr. Laura Marks. She's an assistant professor. She's an assistant professor of medicine in the Division of Infectious Diseases. And in addition to listing really specific examples of sponsorship, mentorship, and collaboration, one of her nominators wrote, what's most remarkable about Dr. Marks is her humility, collaborative spirit, and unwavering support and advancement of those around her. We proudly nominate Dr. Laura Marks for the AWAM Lead Award as junior faculty members who has substantially contributed to our career development and advancement as physicians and as women in medicine. And I've had the pleasure of knowing Laura since she was a resident, and I'm really excited to present her with the award today. Let me give you the box. So congratulations, Dr. Marks, on being awarded the lead award for this year. And now on to our next category, which is for associate professors and professors. So Dr. Nancy Bartlett is awarded in that category. And so she's the Komen Professor of Medicine in the Division of Oncology, and one of her nominators wrote, Dr. Bartlett has excelled in multiple arenas at each stage of her career. She's served as a mentor and role model for women in academia, not only here, but internationally. She's an international leader in lymphoma research and has been instrumental in many of the recent advances in the care of lymphoma patients. And moreover, her passion for mentorship with regards to clinical research and career development is pervasive in all of her actions. And I have to say, her letters were very specific. They were amazing. I just told her, like, it was just a joy to read all of her accomplishments, not only in her research, but really specifically about her mentorship and her role, not only here at our institution, but across the globe. So congratulations, Dr. Beth Bartlett. So again, congratulations, Dr. Bartlett, on your award today. Oh, I don't think sorry, I didn't advance the slide. I forgot. Well, here they are. I guess it was intentional so we didn't spoil the surprise. All right, so now we'll get started with the seminar. So I'd like to introduce Dr. Leslie Gewin, who's going to be the moderator for our panel today. So Dr. Gewin's an associate professor in the Division of Nephrology here, and as also a staff physician at the St. Louis VA. She's a physician scientist whose research interest focuses on understanding the basic mechanisms of underlying the kidney's response to acute and chronic injury. And in addition to her basic science and clinical interest in kidney disease, she's really passionate about supporting women in academic medicine. And while at Vanderbilt, she chaired a Women on Track program that was an initiative to promote the advancement of tenured track women. And she served as counselor for Women in Nephrology, which is an international group that provides mentorship and professional development to both men and women in nephrology. She's currently on the executive committee for advancing women's careers and on the Forum for Women in Medicine executive steering committee, and as a board member of the Academic Women's Network here at WashU. So I'd like to welcome you up to the podium.
I'd like to invite we have a great group of panelists. And I think the idea is that this is going to be a very sort of informal discussion about climbing the academic ladder and insider tips for success. Welcome everyone for being here. I think we have our folks here. So this is supposed to be a very informal process. And I think my own personal experience, I felt like when I was in medical school, everything was very structured. And then you finish things up and then it's sort of this amorphous, like how do we, what is the structure for being successful in academic medicine? But we have some wonderful panelists who have definitely reached the top rung of the academic ladder. And please use this opportunity to sort of learn from them, some tips for success. It'll be very interactive. So if you have any questions at all, then just raise your hand and we'll try to have it more of a Q&A type format. But I thought that we would have each panelist introduce themselves as a Dr. Brown. Yeah. Can you hear me without the microphone? Okay, I'll So I'm Angela Brown, professor of medicine in the Division of Cardiology. I'm in Lifer. I've been here almost 37 years. So I like to say it's probably time to grow up and leave home. But in that role, I do clinical hypertension in the cardiology division. But my other role is I'm vice chair for health equity for the Department of Medicine, focused on our diversity, equity, inclusion, and allyship efforts within the department. And I also co-direct our Center for Community Health Partnership and Research for our ICT effort in the Institute of Public Health. So very involved with community engagement and thinking about health disparities, health equity, and so. Thanks for joining us.
Hi, I'm Lynn Cornelius. I'm Division Chief of Dermatology here. I'm also a lifer. I'm probably about the same amount of time, but I actually came back for a short period of time. And I've been in institute for over 20 years. Did a fellowship at Emory in between my residency here, then coming back and faculty, Division Chief. and have like really enjoyed the academic environment, especially melanoma. I don't have a lot right now. I do a lot of administrative stuff, and also nationally I'm president of our society of dermatology now. I've been president of our association of professors of dermatology. So doing a lot of advocacy for all of us, as well as a lot of diversity work. So I'm really honored to be at meetings with Team Pham. And I am also a and because you both of you have been here for 8 years, so internship and at the last. So working at my first job. So there's a wonderful place. I am a physician scientist. I have a science or my interest has always been in arthritis, so
Fantastic. So I think just to get things started off, and again, this could be very interactive, so please raise your hand if you have any questions. One thing I'd like to ask our panelists is what would they, what piece of advice would they give their self 15 years ago? You can talk to yourself 15 years ago. What are some of those tips that are, maybe not really talked about in academic medicine that are really important to your success and sort of advancement and in the academic life? So if anyone wants to tackle that, in 15 years, you could be, thinking about the starting off as a junior faculty member, when you think about yourself in that position, what would you tell your younger self that might make the path easier?
I'll start. I'll also use the microphone, so I think you're on recording.
Can you hear me? So some of the things I would tell my younger self are the things that I continue to tell my older self. And I'm not sure I learned those lessons very well. But I think basically core values are super important. And always being true to yourself, being fair. I found that, being around for so long, it was a different environment. Not that it's easy now, but, we didn't know what microaggression, we felt microaggressions and macroaggressions, and we didn't know what they were called. We didn't have the toolkit or the toolbox to really know how to appropriately handle them. And so some of the things I've learned that I used early on, I still use today. I'm not sure they're the best ways to approach these. I find that I'm really bold, and I tend to speak out. Vicki Fraser will acknowledge this. I tend to speak out a lot and use humor. I'm not sure that's always effective, but I think being a smaller woman, I found that effective early on, a little bit of shock value without being disrespectful. I would tell my younger self at this point in time, probably not the best way to handle those situations. And I think be a little bit more introspective when you're in a situation with a lot of people. What is everybody bringing to the table? I've always been cognizant of everybody, and I tell this to whoever I interact with when I'm coaching, remember that we all come to the table interactively with different baggage. And if people are acting inappropriately, you have to kind of ask yourself why they're doing that. They can't cross the line of being really malignant to other people, but try to understand where people are coming from, be introspective, and try to react appropriately in that way, but never let anybody abuse or be malignant to anybody else.
So that's kind of an interesting question, because when I think back 15 years, it's almost like I'm doing the same thing now that I was doing 15 years ago. But I think to Lynn's first point about staying true to core values, remembering why I went into medicine to start with, and it was about service and helping people. And my first thought was, about helping those who can't help themselves. And I think when I look back, what I realize is there's a lot of different ways to do that. And so keeping an open mind, but being willing to adapt as you go along the way, because I started out purely clinical, thinking that the only way to take care of people was to be in the clinical space, be in clinic, treating people, making prescriptions, writing prescriptions. But then what I learned moving along was that I can still do that and have an impact by being in community, developing relationships, bridging those gaps in a different way. And then when I transitioned into this role around our ideas work, around diversity, that's still making an impact, but it's in a different way, because if we don't think about inclusion and belonging and making sure that everyone has a voice and that voice is heard, then that impacts how we take care of our patients. So you're still taking care of patients and you're still taking care of those who can't speak for themselves. You're just doing it in a different way. So I think for me, it's really just stepping back and thinking about keep an open mind, keep the focus, but how do I continue to change? How do I continue to adapt to make sure I'm still doing what I really set out to start to do?
All right. So what have I learned? I learned that I should not really say yes all the time. But I think that what I learned, and I think this goes to all of you out there, is that you come to the table actually with a lot of values that you can bring to the whole organization. So know that you're worth something. Okay, don't let people tell you what you're worth. You should know what you're worth, and you're worth a lot. You all have something to contribute, to the to the whole, the department, division, whatever endeavor that you're going to go into, even if you go out into private practice, for example. So that's one thing that I learned, and that's one thing that I think I try to instill in all my faculty, especially my junior faculty, as they start out their career, is that they have something to contribute, they have something to bring to the table, and just don't forget that those values, and that will take you far.
I would add to what Christine just said. I mean, women typically undervalue their worth and what they can bring. Like someone will come to you with, would you like to do this? You have a great sponsor. You'd be great for this job. And women many times will say, oh, I don't know. I'm not sure that I have all the skills or, whatever. And to the men in the room, the allies, we're so happy you're here. But not to like kind of generalize, but men are a lot more likely to say, hey, if you think I can do it, I can do it. So I think it just tags along what Christine just said, value yourself, know your worth. If someone's believing in you and they're in a sponsorship type position and they're a leader, they would not bring you to the table unless they thought that you could bring value to what they're recommending you do.
Wholeheartedly agree. Looks like we have a question from the audience.
Thank you so much, Kelly McWood, pulmonary. So, kind of along those lines of staying true to who you are, I find that being a mother is part of my core values, and that helps me at the bedside of my patients. It helps me multitask, juggle, do these things. But I think, and maybe this is a self-imposed thing that I think about, but like talking about that in the workplace seems to almost like devalue my opinion. or, using that experience that I have outside of the hospital, kind of is not as strong as, say, a man who talks about him coaching a baseball team. Which is great and helpful, and brings other values. And so how do you kind of talk about that in a way that still brings respect for all the other avenues of our lives, and we do feel adds to our care of patients?
So that's a really good question. So I went through that. My daughter was born when I was a resident, and I found that it allowed me a way to relate, particularly to my patients from the standpoint of understanding where you're coming from. A lot of our patient care is about relationship building. And for me, I use that as a relationship builder. Now, that wasn't with every patient, that came through the door, didn't care. It's like, deal with it or whatever. But in talking to people about, the struggles that they were having, it was a way to say, well, I understand where you're coming from. And for most people that works, but you kind of have to know who your audience is. I would say with colleagues, I tended to draw more of a line. I tried not to talk about the work life, what was going on at home, my kids, my family. And I think it was just from that standpoint of being a woman, and particularly being a minority woman, it was that ingrained of you have to do it well, do it better. And so if you show any sign that there's something else going on, that it will be used against you. So I really chose not to do that. But I will say the couple of times that it did come up, it ended up for me being in the positive. And I don't know how much of that was the fact that we hadn't discussed it before and they approached me just out of, hey, well, what do you do outside of work? And I was like, oh, they're actually interested that I have a life. But it wasn't something that I put out there. And I think that's something that as women, we struggle with. And you really just kind of have to find that personal balance, I think.
Okay, so those of you know me, I don't have kids, but I think that what I have noticed, or what can happen, is that maybe people are looked over for opportunities if you might have young kids at home. And it's not out of any malice. It's like the supposition, well, like you're so busy, you've got all this work, you've got kids. So I think that may translate into putting yourself out there. You know what I mean? It's like, hey, that's something I would really like to do, or I think I could really do a good job at that. And then you're being a little bit more forceful, which I tend to be, even though I don't have kids. And it says I can do that, So I think that's one caveat to that. So the other mother on the panel who just had a grandchild.
So I was pregnant as an intern for 8 out of the 12 months. And I think I was the first in the department in medicine to ever be pregnant as an intern. My program director didn't know what to do with me. When I told him that I was pregnant, I think there was this pregnant silence for about 30 seconds before, he came up with something semi-appropriate to tell me. I don't recommend that, but it gives me a different perspective as how to think about family situations, especially with my own faculty. I was also very fortunate to have a PI, my mentor, who value family basically above anything. It was Tim Lay, by the way. And, I think he gave me the role model. And that's kind of how I approach family situations with everybody, not just my staff, my faculty, everybody, is that, you need that, we needed that during the pandemic. I worked with my staff trying to figure out how to balance that because there was no childcare. So I think that it comes from the top, right? And you need, and I think things are changing. I think people do realize that there is a need to balance work and family, and that they're both important. And if you don't take care of your family, you can't really take care of work. So, I try very hard to make that work balance for everybody in my division. And I think that, Vicki does too, for the entire department. Things are, I think, moving in the right directions, but you just have to basically, stand your ground, and just have to make people realize that there's more than just, spending 16 hours, in the lab or at work or seeing patients or whatever.
I would add that if there are any situations that come up that you're like uncomfortable with, or you feel like you needed, some guidance on how to navigate, I mean, this is a very welcoming community, and you can figure out who you have relationships with and kind of talk through or role play or something like that.
And I would say that some of these feelings probably never go away, because even, at this point, when things come up, unfortunately, I had 2 deaths in my family over the summer, and I felt bad about needing to step away to take care of that. And I shouldn't have felt that way. And when I thought about it, if someone had come to me, if you had come to me and said, hey, I had a death in the family, my first response would have been, go take care of your family and do what you need to do. But we tend a lot of times not to extend ourselves that own grace.
Yeah, building on that, and then we have another question, which I think is great. I think that life happens, and whether it's kids or other death in the family or personal something that comes up, I think it's really important to have someone that you feel comfortable that you can reach out to and have that support system. And in a minute, might talk about a little bit about the role of mentorship and sort of people who could be your advocate as you move forward. But I want to get to Sasha's question first.
Female faculty feel comfortable kind of expressing, their family and, family life issues and events, including deaths and grief, are places where the leadership does that. So they set that example and they create that permissive environment. So when you have either female or male leaders who openly discuss their family issues and challenges in a work environment, in a work meeting, that kind of allows and sets the example for others to feel comfortable doing the same.
And hopefully forums like this will allow people to, form connections with people that you will then feel comfortable going to if you have a problem. And because there's a really good chance that someone else has had a problem that's similar to that, and you're not alone in whatever that struggle is. And I think it's really important to feel connected with other, other people who can help out with that process. Any other comments on that before? I think one thing that I think is super important as you move throughout the academic ladder is just the role, and I would say mentorship in a very broad way. A lot of times people think of mentorship and they think of their primary mentor and choosing that person. But, it's very rare that one person, or impossible that one person can fill all your mentorship needs. And I think how did you seek out support, whether that be, sponsorship, mentorship,
to kind of advance along? Was it something that someone, was sort of happenstance, someone really important happened to sort of fall in your sphere and they were really helpful? Or did you have to take a more proactive role in seeking out people who you felt like would be helpful in your academic pathway?
So I think for me, things sort of fell organically. I didn't really seek out specific mentors. And just a quick story, just even the work that I do in hypertension came about because I was at a hypertension conference in San Diego, sitting across the table from someone, and I noticed that they had a WashU badge. And I said, "Oh, hi, you're so-and-so. I've seen your name. You're from WashU?" "Yes, I am." "And you're Angela Brown. You're from WashU." We had never met each other, and this was a senior person, but found that we had a common interest in hypertension. And I said, "Well, this is what I'm really interested in doing." And this person said, "Oh, come talk to me when we get back." I had no idea. And when we got back, we had that conversation, and our hypertension center was basically born out of sitting across from each other at a conference in San Diego. And then since then, just when things have come along, it's really been a more just sort of organic things falling into place per se. But there have been a couple of times where I was like, I really need to talk to someone about this. And I've kind of asked around, who's in this sphere, and really sought someone out. But a lot of it has been just more organic. But what that's led to, though, is I think I would say more so the sponsorship aspect of it. And don't underestimate the sponsorship, because the majority of the work that I've done on national committees and internationally has been more so through sponsorship type relationships. It started in that manner than it has from just pure mentorship in that area. And the sponsors have been great because even though it started as sponsorship, it went the other way. It turned into mentorship after that. So it can actually work both ways. But don't be afraid to say yes, because the sponsorship is someone coming saying, I put you up for such and such, or someone invites you for something, and you have to say yes. And then once you say that initial yes, then you start making those connections and then start building mentorship relationships. So for me, it actually went the opposite direction. An initial mentor, a lot of sponsorship, which then turned into several primary mentors across different areas. And I can't say that I've just had that one specific mentor. It's really been a collection of mentors because I've needed mentors in different areas, and not everyone could supply the same degree of response that I needed.
Okay, I'm going to tell you a funny story. And I would never do this today that I did back in the day. So those of you who are older know Bill Peck. Bill Peck was a dean of our medical school, I don't know how many years ago. So the initial, and this is a good story for Renee, the initial Office of Faculty Affairs, I think the faculty said to Bill, we need an Office of Faculty Affairs, we need to know about promotions, we need some advocates. And so he's like, okay, whatever, and he was very supportive, but he calls me up and he goes, "I'm an assistant professor. I think you should do this job." I'm like, "What is it?" He goes, "I don't know, we'll figure it out." I'm like, okay. So 3 months after acknowledging, trying to figure out, let me get there was no, like, the promotions document wasn't available. And at the time we weren't even having it on the internet. I made a portfolio type thing. 3 months into the job, he calls me, and I still remember where I was when he called. He goes, "Hey, Penn's having this Faculty 2000 thing, and they've invited me to come and talk about what we do at WashU, and I want you to go." And I'm like, well, what do I have to do? And he goes, I just talk about what we do. And I'm thinking, I don't really know what we do, So I'm like, okay. So at the time, the only way you could get any faculty data was through payroll, right? So we went to HR, I went to payroll. I'm like, well, I'm going to make a PowerPoint. I'm going to figure all this out. Here's our women, this, at different degrees and at different ranks. So I call him up and I say, "Dr. Peck, can I show you the PowerPoint?" Now, the big mistake was I did not ask him who else is going to this Penn 2000? And he says, sure, come show me the PowerPoint. So I show him the data. He said, that looks great, looks great. I go to Penn, get picked up by a limo. So the other people that were there was the Dean of Harvard, the Dean of Columbia, and the Dean of Hopkins, and me. And I'm there, put on your big girl pants. You're here. And it was actually a great experience. And I do think, so we talked to faculty, we showed data, and the deans, got up and kind of touted their stuff about their schools. But I think as a faculty member, I probably had a better communication with the faculty. But it's one of those things, say yes, but get the details about what you say yes to. So he was a sponsor.
So I came up through the investigator track, for some of you who may be contemplating going that way. And so for that, the most important thing for me was to find the right mentor, the right lab and the right mentor to do your postdoc or whatever it is that you're doing. And I actually Google or search my mentor up, and people around me say, no, don't go into that lab. Just don't go there, because Tim is incredibly opinionated. Just don't go there. Well, I didn't take anybody's advice. I actually went to Tim's lab. Tim Lay is what I'm talking about. And, I think Nancy knows, Tim is basically the most wonderful mentor that anybody can ever have. And that's what I actually learned, is that, you need somebody who will be your champion, who basically, values you as a person in the lab. Again, I talk a lot about, everybody's self-worth and self-value. But, Tim is, Nancy knows, I'm not sure if you all know, but, he's a world expert. He is recognized all over the world for his work. But what he really values the most is his award for being a mentor, to all of his students, postdocs, faculty. I mean, that's really what, he valued the most. And when I left his lab, he told me that, you guys are my legacy. You do well. I look good, so so that's kind of what, I try to do, with my faculty. And, so when I became chief, half of my faculty are not on the investigator track. So the other half, the clinical track people, basically, they really never had anybody to tell them what it is that they have to do to get ahead, to get promoted. It's pretty nebulous. Thank you, Renee, for straightening that out. But, there was nobody actually told them, what were the expectation for them to move up the echelon. It was very nebulous. If you're not doing research and you're not getting, your R1s on your publication in the top 3, whatever, which is what we were told that we're supposed to do, a lot of them kind of left in limbo. It's like, how do I move up? And a lot of the time people get tired and they leave. So I would say that it's really important to find not just a mentor, but maybe even a mentorship committee, people that you can sound off, people that you can get advice from, and whatever that you're doing, your specific path that you're choosing. And I think that's really one thing that I had learned over the years.
Listening to Christine talk about Tim, I think the overriding themes are people with integrity, right? Look for people that have integrity and people that will be honest with you, that will give you feedback that may be tough to take, but they'll be honest. And I think it is a mosaic. I mean, that term has been used for mentorship. I think it definitely is. And sponsors are important too. And don't be afraid, you know, you may be at a meeting and you see somebody that's, you know, nationally known and it's in an area you want to go up and introduce yourself. You know, that person could be a sponsor for you sometime down the road. And don't think that people don't want you to do that because, you know, that's what they do. And I think it's really important to recognize that.
That's very true. And actually one of the things that Christine just mentioned about promotion on the clinical track. I was on the clinical track and I decided that this was what I wanted to do for my career. And again, that, you know, how to get promoted, it just wasn't clear. So Vicki likes to say that I'm bold, I think. But what I did, this was the department chair beforehand. When that department chair came, I made an appointment. And a lot of you know who that was. So I made an appointment and went in and said, hi, I'm Angela Brown and blah, blah, blah. And I want to know what, you know, what your goals are and what your expectations are. And we had a nice little chat. And the next year I made an appointment and I went back. And I think after about year number 3, he said, why are you here? And I said, because I want to be clear about the expectations, because I really wasn't getting that from my division chief. I mean, I was getting some general stuff, but I figured, you know, go to the top. And so we had the conversation again. And he said, well, you're doing X, Y, and Z, and you're fine, and blah, blah, blah. And I said, okay, well, I just wanted to make sure that I'm fine. But I felt I needed that. And so I say that to say, talk to your division chiefs. And if you don't feel you're getting what you need, tell them, I need more. I need specifics. And sometimes you just have to ask that. Now, that shouldn't be an issue anymore. But back then, it was really kind of a problem because I had this feeling that I was just going to kind of linger in junior faculty status forever if I didn't have clarity. And so I just made an appointment and showed up.
Yeah, building on that, I would say at my prior institution, early in my career, I remember I thought that my division chief would ask to meet with me. And about 2.5 years went by. And at one point, I had a mentor committee and they said, well, when was the last time you met with your division chief? And I said, well, he hasn't, you know, scheduled a meeting in 2.5 years. They said, no, that's on you. That's your fault. You need to be sure you're meeting their expectations and you have an understanding of what his expectations are. So I think that's great to be proactive about it because everyone is so busy, and to make sure that your needs are being met and that you're meeting the expectations of your track and your division are really important. And in terms of a shout out to Dr. Shellhouse, she'll be speaking later on in this seminar about promotion. So I think that's an incentive to stay for the duration of this seminar. But a lot of, yep, Dr. Fraser.
Just clarify, every single faculty member meeting or division you at least once a year, maybe more frequently than that, you know, depending on what you're doing in your career goals and development. Every single faculty member should have a career development plan and a mentoring committee, because those are key tools for your ultimate success, no matter what track you're on, no matter what you need or want to do long term. And your section chief, division chief, your department chair can help you find that mentoring committee, but it really is on you, right? And so if they schedule it, great, but if it's not, you all really need to drive your career in that way.
Thank you. Totally agree. Definitely. So we've had a lot of talk about mentorship, sponsorship. Question.
Oh, I wanted to maybe ask a related question then. So obviously mentorship is so important for us to find appropriate mentors. I'm curious on the flip side in how you are mentors to other people and how one can balance the many requests for mentorship from people more junior with your own work-life balance and other things of that nature. If you can comment on that.
Who needs sleeps, right? Um, it is a balance, and it is actually priorities that I have to set aside. What I need to do with my faculty, what I need to do with my staff, what I need to do with my family. Actually, patients is somewhere in there also. So it's just that, yeah, you just have, for me, I need to basically just carve out those time for all those pots and the 7 meetings that I have on a daily basis. But it's going to have to come from the mentor, the willingness to basically spend the time, with you. And so that's why it is important, when you find that mentor, in the process of finding the mentor, that you find the right fit, the right people. You're not, especially for people in your category, in our category, it's not just, the papers that they publish. It really has to do with, their style of mentorship and their willingness to be your mentor. That's really important, to find. But, it's as some people are very frank, some people may not be, and you might find out after being there for 5 or 6 years that, you can't do this or you can't do that. But I would say, you need to just do your homework and find the right fit, in the long term. But there's absolutely no formula as to, who that person is. It's really, it's really tailored to you.
So I appreciate that question. And I think for those of you who are mentoring people, that at least for me, my secret was actually to just make it part of your regular day and part of your job. And I'm not the kind of person who is heading a mentoring committee and meeting with them once a week for a separate, let's go over everything you're doing. I mean, I feel like I'm mentoring constantly when I'm at work and with people who are my junior faculty or my fellows or residents, that I am very outspoken, as you guys have talked about. And I think it's just really important when you are mentoring that you just look at it as every opportunity. So for me, I have a fellow in clinic. At the end of clinic, there was something that I need to point out to them or something that came up as an opportunity. Hey, you know what, we should do a retrospective study looking at that question that you had on that patient, not, come meet with me in 2 weeks and bring this with you. So don't hesitate to do it on the spot. And, I give people a lot of feedback, which can be pretty difficult sometimes to take, but I will tell you that most of the people, the residents and fellows and junior faculty, when I'm giving them feedback that might be hard to take, extremely appreciative and moving forward with a very positive attitude and I'm here to grow and that sort of thing. So I think you can really be a daily mentor in a very, sort of informal situation. And I would really encourage all the faculty here to not be afraid to give people feedback on just even seeing one patient or, giving them very frank feedback about a manuscript or an abstract, and don't be afraid to use the red pen. They all love it.
Yes, I'd like to echo. I think that the importance of getting feedback from your mentor is absolutely critical. And I think my first, drafts there was more red than black on the paper edited track changes. And I think that's a good sign. That means that your mentor is investing the time to go through your work and provide that feedback. And it can be hard to receive sometimes, but it's really important for your growth. So I think that in addition to integrity and honesty, then the time of getting the good feedback is another feature of a good mentor, as well as generosity and just in terms of how they look at your success, that they view their success or your success as part of their success. Yeah.
I'd just like to add that mentorship actually takes different forms. And Nancy mentioned informal mentorship. I've had people come to me not about their academic track or their area of specialty, but about the work-life balance. And I tend to have sort of this open door policy, call me, whatever. But a lot of it has been, just navigating that other side of the space. You have your primary mentor for your specialty area, but then sometimes you just need that person to talk to about the balance and the social aspect of it as well. And so some of my, I think, more formidable relationships from a mentorship standpoint have been in that space and not exactly the content of the work.
I think I'm probably more of an informal type mentor, like Nancy mentioned. Hopefully, like, the door's always open in my office. I rarely have it closed. Maybe I need to be more purposeful in reaching out to people. But what I find, this is invigorating to me, as hopefully it is to the people that are in our division. Like when we go to an investigative meeting and one's coming up, and we are a presence. There's a real camaraderie with, like, Christine and Dave Chen and a bunch of our investigators, and people come up to me and they're like, how do you do that? And I try to connect, like, the people that I know that are junior that may need a mentor in their area of science, because I've been around long enough to know a lot of the people. And so kind of in an informal way, mentoring the science through connecting people, maybe that's more of a sponsor. But also, I can tell you, at this stage of my career, there is nothing better than watching you guys succeed. And you don't take credit, but it's just awesome because, and you always want to surround yourself with people that are smarter than you are, which I have done. And it's great. It's great. So kind of a long-winded answer. Yes.
No, okay. And I just to build on that, I would also say, use your opportunities when you go to outside meetings to connect with people and find, I would say, mentors from afar. People at different institutions can offer different perspectives. A lot of times they don't have a dog in the fight when you have an issue that comes up. So I think, and it's also helpful for then your promotion process, right? You have to have people who you meet that will write letters on your behalf who are not your collaborators. And so I think really being intentional about those outside meetings and trying to make connections can be really, really helpful. And we're running a little low on time, but we have time maybe for one or two more quick questions. If anyone else has questions with this great panel about mentorship sponsorship. Yeah.
Research side, a lot of women ask, how do you make your voice heard in a meeting if you're junior about very strong.
Do not worry about seeming pushy. I think, you're respectful, right? And you speak up and you make comments. And if you find that your comments overlooked, you come back and say, yes, this is what I mentioned. But I think the pushy thing is it's not relevant to me.
Yeah, I'm not sure what you consider pushy, but yeah. Yes, you need to be confident of what you're presenting, and you should not be afraid to speak up. You should not be afraid to show what you have researched, what you have found. If you want to, like then say, you can disagree. We disagree all the time about science, right? But, just do it a respectful way, methodical way. But just do it. Just not be afraid, because you're a woman that nobody's going to listen to you. I think there are enough women in science nowadays that it's not like it was, 40 years ago when I started out. There was something called a boys club. That, one or two women are allowed to, in, but they're never really allowed to speak up. I mean, you are part of the fabric of research, the research workforce. So I would not consider yourself pushy that you present your point of view.
What do you tell them when they ask? I feel that I tried to ask this question. Yeah, I have to come up with some of that, but I think to make it, right? Just ask, you have to be. Peggy has a comment.
I think this is actually a really common problem among many women, and I'm sure I felt it myself for the vast majority of my career. So I think you have to practice. You have to practice public speaking. You have to practice projection. You have to be louder. You have to be more direct. And you have to enlist a posse in your meeting, right? Because sometimes women can be overspoken or not heard, or someone says the same thing you said, 15 minutes ago, and suddenly it's a brilliant idea. And Bob said, and Susie said it 20 minutes ago. So the other women in the room have to amplify and say, that's so great that you're chiming in on Susan's idea, which she mentioned 15 minutes ago, and, was her original thesis. And thank you for recognizing. But you got to practice. That doesn't come easily. And so you can practice in little groups. You can practice before the meeting. But you do have to speak up, be loud, be direct. And the more you do it, the easier it gets.
It's fun.
So
You may have an easier time doing it advocating for someone else than yourself.
Yeah.
But so remember, just like Angela said, or she said, have grace for yourself and do for yourself what you would.